I first became involved in pancreatic cancer research when my aunt passed away from late-stage lung cancer. Seeing how well she progressed on targeted treatments made me really want to make that available to people who have a challenging disease such as pancreatic cancer.
As a medical oncologist, I wanted to be part of something that was going to provide treatment options to patients who, over the last few decades, haven't had many options.
Seeing patients suffer from pancreatic cancer really cemented that this was a major problem and something I wanted to do as much as I could to combat.
Seeing the need, maybe want to study this disease in the laboratory and ultimately help to find new treatments for patients with pancreatic cancer.
My name is Tyler Jacks. I'm the director of the Koch Institute for Integrative Cancer Research at MIT. And we felt that we had the tools and the technologies that might help shed light on why that challenge existed and what we might be able to do about it.
It really had been considered a death sentence, that if you got this disease, you would die from this disease and you would do so very quickly. That really is changing.
When I first started over a decade ago, there was only one drug that was being used in pancreatic cancer treatment.
There were very few people studying pancreatic cancer. Now there are hundreds of laboratories across the country that are focused on this disease.
We're now really a small army of investigators, all with a common goal to bring new findings as quickly as possible from the lab to the clinic.
At Dana-Farber, we have a very large research program in pancreatic cancer. In my own laboratory, we are very focused on early detection and also new treatment approaches.
By identifying biomarkers for early detection, we can identify pancreatic lesions earlier.
We've developed genetic approaches where we can study each gene individually.
Our work is focused on what we describe as preclinical models of cancer, and those are largely today based on genetically engineered mouse models of cancer. And if we can understand how the cancer is inhibiting the immune response, it might indicate new mechanisms or new strategies, new drugs that we can use in the future in patients to bring about a proper immune response against the cancer.
We're working very hard to understand the biology of the cancer and intervene to interrupt that biology and result in better treatment.
In the next 5 to 10 years, I anticipate continued growth.
There will be new therapies and therapeutic combinations that extend the life of pancreas cancer patients, and some of those might even be curative. That might happen at the longer end of that time frame, but I'm optimistic about that.
Pancreatic cancer for a long time has been considered a death sentence, and years ago for good reason. But a lot has changed over the course of the last 10 to 15 years.
Even 20 years ago, our understanding of how pancreas cancer arose and what it looked like was extremely limited. And today, through investment in basic research in labs like mine, we have a very clear picture. This is a very serious effort. It's an international effort. It's a very focused effort. As we've seen for other cancers that were very, very difficult to treat not that very long ago, and I'll use melanoma as an example, are much more treatable now.
Research is hope. As we do research to understand the disease, we find new treatments and we treat patients better.
We know more tomorrow than we do today.
We will see the benefits over the next 5 to 10 years of all the hard work that's going on throughout the world.
Patients really are doing better. They are living longer, their symptoms are better controlled, more patients are being cured from their disease.
We're working hard on this problem. We're committed to finding a solution.